Well, we certainly know that under your leadership at the National African American Drug Policy Coalition, it will be making a difference in the lives of young African Americans, males, and also those that are not only of African American descent, but of any race, because some of the underlying points that you just made about the whole poverty issue still remains and becomes a kind of attracting force for young people. And we know that we need to do something about that and begin to let them realize their worth and how they can move forward and accomplish anything that they want to accomplish. And let me just get you to speak a little bit, Judge Arthur Burnett, about the disparities that you have noticed throughout the DC area in the sentencing, or in fact around the country, with respect to whether it be race or gender or any of those type of demographics.
Before I answer that question, I want to address one point you made. One of the criticisms of the National African American Drug Policy Coalition when we started it came from Patrick Kennedy, recently retired as a member of Congress, said, Judge Burnett, he said to me, the only criticism I have is what you're doing is only for the African Americans. You should be doing it for everyone. And I say to him, I say, before we come on and tell everybody in the country what to do, we want to try to clean up our own house, to try to deal with our own people. And what we find that works, we will share with Hispanics and other minorities, with Caucasians who are poor, with everyone, if it works. But I didn't want to be pompous and say we had the magic bullet or the answer for everyone. And he is one of our strongest supporters, and even in retirement from Congress, he has indicated that he will be supporting the work of NADPC. Now, turning to your other question again, with reference to that issue all over the country, not just here in Washington, D.C., we have to develop programs that approach our youngsters. And one of the 5-point programs we have is a program dealing with preventing juvenile delinquency in our youth, in schools, and in the community. We send speakers into the community not only to talk with them about the medical and biological consequences of using illegal drugs, about underage alcohol drinking, and how it adversely affects them. But we don't only want to take a negative approach. We in the National African American Drug Policy decided that we want to start up our own affirmative action program of having speakers go into the schools and become role models for youngsters starting at the 3rd grade, and let them see that many successful black persons today came from humble origins just like they are, and from public housing, from poor families, that they weren't necessarily born in rich families or families that were educated, but they had the drive, the zeal to make something of their lives. And then we have established a program which is unique in the country, and that is we tell youngsters we're not only here to tell you what not to do, but we are here to give you a helping hand. You stay in school till you get to the 8th grade, and if in the 8th grade you can maintain a solid B average and think you want to go to college or vocational school, we will give you a counselor mentor in the field you want to go in to start working with you in the 8th grade, just as if you were the son or daughter of that person. So every black kid in America today who wants to be a doctor, we are in a position with the National Medical Association to have a black doctor assigned to that youngster in the 8th grade to shepherd that kid from the 8th grade all the way through med school. When the National Medical Association say we want to take on that initiative as one of our primary goals, to double the number of black doctors in America over the next 10 years, every one of the other 25 organizations in our coalition say we will do it for our professions. The National Bar Association is doing it for the lawyers. The psychologists are doing it, the social work. But we go a step further than that. When they get to be juniors and seniors in high school, 15 and 16 years of age, we provide internships for these students. But these internships are not just general internships. They are apprentice internships. So a kid who wants to be a doctor works in a hospital, works in a doctor's office, and get the medical. A person who wants to be a nurse works in a hospital. They get the exposure of the field they think they want to go in, as a junior or senior in high school. We are doing that for every professional organization in America to prevent the excessive number of blacks ending up in prison and hopefully increasing the proportion of black professionals in America to the percentage that we are in their overall population. Right now, we are greatly underrepresented.
Listeners, you are listening to Real Talk with host Dr. Valencia Campbell. Now, if you would like to get involved with a local chapter that is committed to helping our youth excel in school and staying away from criminal activity and not becoming a dropout statistics, email the Prince George's County Drug Policy Coalition at pgcdpc@hotmail.com. You can visit their website at www.pgcdpc.com. The group would love to have your support with their Speakers Bureau or helping with a mentoring program. Now, I'm back with our guest, the Honorable Judge Arthur Burnett, the National Executive Director of the National African American Drug Policy Coalition, Incorporated. Judge Burnett, what is the National African American Drug Policy Coalition doing right now to combat the chronic problem of drug abuse and crime? You've already talked to us about some of the programs that are in place as far as the mentoring for the various professions and so forth. Could you just mention a few of the other things nationally that you didn't get a chance to mention prior to our comments about the one of the local chapters? If you'd like to comment a little more about some of the other chapters across the country, because I know that you have been starting up local chapters quite a bit throughout the nation.
Well, that's a two-part question. The first I wish to address is that we have become a strong promoter of what we call drug courts in America. There are over 2,400 drug courts, and we advocate that drug addiction should be treated as a medical problem, and that when people personally possess small quantities of drugs, or even incidentally selling merely to get their own supply, this should be treated like a mental illness, and they should be treated rather than convicted and sent to prison. We advocate that Congress and state legislators appropriate more money to provide for drug courts, and that prosecutors agree to allow people to go into these drug courts and dismiss the criminal charge when the people are successful and achieve, so they don't have an albatross or a cinder block around their neck by way of future employment and opportunities. So we work in very close collaboration with the National Association of Drug Court Professionals. The President of the United States only this past Friday, May 13th, issued a statement indicating that drug courts are the most successful innovation that's been developed to solve the drug crisis in America. My comment, of course, is I agree with him, but we need to double the number of drug courts in this country to serve that purpose. And then rather than giving people convictions for possessing drugs or incidental selling, when it is a product of that addiction or dependency, is a policy we ought to change. And we are advocating that and working with legislators throughout America to get as much money in these fiscal austerity times as possible. We are urging our local chapters to work with their local mayors and their local city councils and with their state legislators to get additional monies appropriated for these programs. And then we go out and we serve as proselytizers to convince landlords to provide affordable housing for people who recover from drug addiction and drug dependency. Notwithstanding the popular concept or myth that once a drug addict, always a drug addict, in my 7 years of being on sabbatical, and here I've met many, many people who have overcome their drug addiction and gone on to college and finished college, sometimes gotten master's and PhD degrees, or even become professionals, and sometimes are our leading citizens, and yet they had a drug addiction problem. People do recover from drug addiction. They do recover from alcoholism. And sometimes they become saints. They do more for the community than people who have never had a problem. So recovery does work. And we need to promote that and need to have our chapters involved in doing so.
Why don't you mention a couple of points about other things that the community can do to get involved? You talked about getting word to their legislators and trying to be activists and so forth. What about a few other things, the volunteer efforts, financially, and that sort of thing?
Well, three things. The community can get involved. Number one, senior citizens who are still in good health and are bored with not having anything to do can volunteer and work with our chapters or work with our nationals to be speakers in schools where we go in and talk to youngsters and give lectures or presentations to youngsters. They can also be counselor mentors where they take a person under wing and motivate them to achieve and achieve their potential and become all that they can become. They can also contribute to the local chapter or to the National African American Drug Policy, which is a 501c3 chapter operation, and it's tax deductible. They can send checks to the national organization, to Howard University, to Rosalie Morris, Morris, room 400, Holy Cross Hall at Howard University School of Law, and take it as a tax deduction. One of the problems we have is the demands on our services as far as outstripping our revenue income. So if we had sufficient charitable donations, I could hire 2 or 3 people to help me carry out these functions. I'm spending at least 15 or 20 days a month traveling all over the country, spreading this message and encouraging people to participate and to contribute to this unified effort of African Americans to lift themselves out of poverty and to defeat the pipeline to prison.
Fantastic. Listeners, you've heard all that you can do. We hope that this has inspired you to really move forward in your quest to help our youth. You've been listening to Real Talk with your host, Dr. Valencia Campbell. I would love to hear from you, the listeners, about this show or about some burning issue that is on your mind. You can email me at pgcdpc@hotmail.com or campbell@advicefromtopwomen.com. Remember to visit the Prince George's County Drug Policy Coalition's website at www.pgcdpc.com. Next week, we will be discussing getting arrested versus getting a warning. I want to give special thanks to Judge Arthur Burnett for taking the time from his incredibly busy schedule to join us today. Judge Burnett, we salute you for all that you're doing, both locally and indeed across the nation, on behalf of the nation's youth. To my listeners, remember, we all can make a difference. People who say it cannot be done should not interfere with those who are doing something. Have a wonderful day.